Today you're facing a choice. Oftentimes you have to decide between the way that you want to provide care and the economic realities of a modern practice. As costs continue to rise, your compensation has remained flat or even reduced. Practice income is limited by how many hours you work and how many people you see each hour and each day. You may be one of those doctors who's working a frantic pace. You may be worried about the demands on you, your family, and your practice. In this difficult environment, service levels may be slipping and patient satisfaction can be waning. The majority of primary physicians have to choose between changing their practice standards or just continuing to sink in a downward spiral. The demands are even more challenging for mature physicians, and the future for increasing your third-party compensation is certainly not very positive. So you're pressed to choose between delivering care the way you want to, the way you think it should be delivered, and have your compensation stagnate each year, or consider an alternative, the Concierge Choice Physicians Program. Patients are often struggling with the complications of the modern healthcare system. As visit time with their primary physician is reduced or handled by multiple providers, there is less attention to the emotional component of care. Patients face telephone systems and office policies that are designed to insulate them from the busy doctor. Many patients want to enhance the great relationship that they have with their doctor and want more time and personal attention. They want to keep healthy, but sometimes need more support to help them comply and to be proactive. Unfortunately, patients often face growing waits for appointments, longer waiting time to see the doctor, and shorter visits with the doctor. Patients want more, but cannot get it in most traditional practices. In a Concierge Choice program, a portion of your patients pay an annual fee to receive a comprehensive annual screening physical and to participate. You set aside time each day for members' annual physicals and for their follow-up care. Physicals are scheduled on the hour, and regular visits are scheduled on the half hour. If you continue to maintain all or part of your traditional practice, those patients see you during slightly reduced traditional hours. The amount of time you allocate to the Concierge program is dependent on the number of members who join. Usually, membership is between 100 and 150 members. This amounts to 20 to 25% of practice time. If more patients join the program, you can expand the time devoted to it or maintain a waiting list. If you are interested and your practice is capable of supporting a full model, you can transition completely with 200, 300, or more patients. Because the revenue generated in this program is significantly higher per hour than in the traditional practice, your practice income can increase by hundreds of thousands of dollars. Unlike the full model of concierge care, where there are very few physician candidates, many more primary physicians are candidates for the hybrid model. The success of the program is dependent on many factors that include the price for the program, the ability of patients to pay for it, and the relationship that the doctor has with their patients. Concierge Choice Physicians helps doctors determine if the program can work by individually reviewing the practice and by performing a unique written survey to their current patients. The survey is an assessment tool to help review accuracy of the lists and to predict the number of people likely to join the program. Concierge Choice Physicians then works with the physician to develop an implementation strategy that meets the unique needs of the practice. Frankly, if done with Concierge Choice Physicians, there are virtually no risks and no direct costs. This is what makes the program so powerful. The only risk is disappointment if the practice is not appropriate for the model. You can benefit in a variety of ways. You can change your professional environment by slowing down the pace, increase your income, change the dynamic that you have with various payers, and create an environment that supports future retirement. Concierge Choice Physicians is a marketing and support company. We will evaluate your practice for a concierge program, set up an implementation approach that is appropriate for your practice, and then implement the program with you. This includes all aspects of marketing, including running events, creating unique mailings, sending letters, calling the patients to educate them on the program, signing up members and collecting membership fees, creating marketing videos of you in the practice, staffing sales representatives in the office, paying credit card charges, doing legal reviews in your state, and most importantly, working with you to customize a strategic plan for your practice. You probably have a small number of people who would join such a program, but with the help of our experienced staff, we will increase the number of people who will join your program dramatically. Whether you choose the hybrid model as a long-term strategy or as a vehicle to move toward a full model, our flexible approach offers you many choices. Concierge Choice Physicians charges you nothing directly. Our compensation comes from a small portion of the new membership income stream. I invite all primary care physicians and specialists who are the primary physicians to a majority of their patients to consider the Concierge Choice Physicians program. You finally have a choice that gives you back the control of your practice.